So many times it can be difficult to kind of distinguish between the flu and the cold because they have many similar symptoms. People can present with things like fevers, sore throat, cough, congestion. I would say the bigger difference is typically with a flu, you have higher fevers than you would with a common cold. Usually fevers can go 101 degrees Fahrenheit or greater. Also, many times you'll have diffuse body aches with the flu that is less common with the cold. So those are, I think, the two main distinguishing symptoms. Other times with the cold, you notice that the symptoms will come on gradually as opposed to the flu where they might come on steadily. You might have severe symptoms within a day. So I would say those are a few ways to distinguish, but again, many times the symptoms are very similar, so it can be difficult to tell. So the cold is caused by a virus, so you don't need antibiotics to treat a cold. Typically, how you would treat a cold would be just by treating the symptoms themselves. So if the symptom was congestion, you can buy an over-the-counter decongestion. If you were having a cough, an over-the-counter cough suppressant, you would treat the symptoms themselves. We also recommend that it's important to get plenty of rest, stay well hydrated because dehydration can sometimes exacerbate the symptoms. And just if you're having fevers or body aches, something like acetaminophen or ibuprofen can help relieve these symptoms as well. So for the flu, similar to the cold, is caused by a virus. So there's no treatment that's necessarily needed to treat the flu. Typically what we recommend are symptom controlled, similar to the cold. You'd want to buy medications that target the different symptoms you're experiencing, such as ibuprofen or acetaminophen for fevers or body aches. You'd want to get, again, cough suppressants for cough. You'd want to get decongestants for congestion. There is one antiviral medication that many of us commonly know as Tamiflu that can sometimes shorten the duration of the flu if taken within the first 24 to 48 hours of symptom onset. However, even though this can shorten the symptoms, it's not necessary. You can still recover from the flu without any prescription medication. So both the cold and the flu are contagious. Usually they can be contagious for up to 1 week and can actually be contagious up to a day before symptom onset. What I would say is it really depends on how you feel. If you're feeling like your symptoms are pretty severe, it's probably best to stay home. If you are going to go out in public or in the community, it's very important that you good hand hygiene. You want to wash your hands regularly. You want to prevent the spread of any bodily fluids such as saliva because that can really cause spread of the virus. So you definitely want to practice good hygiene. So to prevent spread from both the cold and the flu, which are caused by viruses, you really want to practice good hand hygiene, as I mentioned earlier. You want to wash your hands regularly. You want to prevent spread of bodily fluids such as saliva when you're close to other people or within close contact. The difference between the cold and the flu is that the flu actually has a vaccination that can help prevent the development of the flu. We recommend the flu vaccine annually for all adults, regardless of age, regardless of health status. Everyone should be getting this vaccine annually to help prevent the development of the flu. So that's one of the benefits that we have for the flu in order to prevent this condition.